Good morning, Harold. Now, since Harold can't talk, I would ask the patient the name and date of birth. Then I would clean my hands. Then put your gloves on. So I'm going to demonstrate today how to draw blood from a hand vein, which is always done with a syringe and a 23 gauge needle. So you always want to choose a vein that is straight. Do not choose one of these that are kinked or kind of going in a whatever. So I'm going to choose this vein because this is nice and straight. First thing you're going to do is clean your area. So you want to start in the middle and work your way out. So while this is drying, I'm going to get everything set up. So you're going to need a 10 or 12 mil syringe. You're going to need a 23 gauge butterfly, your 2 tubes, your gauze, and your tape. So I want to get everything ready because you want to get the blood transferred as soon as possible into the tubes to prevent clotting in the syringe. Okay, so this is a needle under this rubber part here. So you want to unscrew it from down here, the plastic part, and just unscrew it, throw it in your sharp container, attach, get the air out, set that down, and this is the transfer hub. It has a needle in it. And I'll get that out also. So I have everything I need set up here. So now we want to put the tourniquet on about 3 to 4 inches above the site you're going to draw from. So about here. Okay. So take your syringe. Now you want to be approximately about a 15-degree angle. You don't want to be way up here. You want to go just about like this. So you're going to poke into the vein a bit and then straighten your needle out. And as you can see, we have blood. So you're going to pull up on this. Don't pull too fast, but don't pull too slow. Now for a draw that is requiring 2 tubes, I usually bring it up to about 8 to 10 cc's. Okay, so that's probably good. So you want to untie your tourniquet, take your gauze, hold lightly, push the button, have the patient put pressure. Then you're going to unscrew this, throw everything away, then put your transfer needle on here. Okay. Now, when I push the tube onto the syringe, it's automatically going to suck the blood in because of the vacuum pressure in the tubes. So you really have to watch and make sure you have at least 3 to 4 cc's left for the lavender. Okay, so here we go. So that's about good there. And then we have the lavender. So never force the blood in. If it stops, that's great. If you have blood left over, no worries. Throw everything away. Invert your tubes about 4 to 6 times. And then you want to check and make sure the patient is still not bleeding. I would get a fresh piece of gauze, put it like that, and then we would get our tape out, and then just put it on like that, and let the patient know to leave that on about 15 minutes or so.